Okay, so I thought I should include some information about the actual medical procedures I was talking about in my earlier video, and different tests that I had to have done so far. So in the past, when I've asked people about how they felt about their experiences, I was told, oh, you can't eat for 12 hours before an MRI or whatever. And so that was part of my fear, that I knew I wouldn't be able to get through not eating and drinking. Well, fortunately now the test machines have been improved, and I was just told on the phone I only have to worry about it for 4 hours before the MRI, and some PET scans and CAT scans are also 4 hours, sometimes 6. I was told 6 in University of Iowa, and at the ER they did a scan on me without any hours of waiting. They just said, we need to do a scan on you real quick, so it took a few seconds. So depending on what kind of scan you're going to get, and depending on where you're getting it, what kind of tech they're using, it can be anywhere from 4 to 8 hours as far as I know. I don't know if places still have it B12 or not, but you can definitely find out. And you are allowed to have like water, obviously ice water. And I'm not telling you not to follow instructions exactly, but if you go and ask them what is the purpose of that, they will explain to you that it's either a matter of how much glucose you have in your blood when they do the test, or when they're doing a contrast CT scan, they want to make sure that the radioactive dye they use for the contrast part is going to go where your blood is going. And if you are like, have a full stomach, your blood is all going to go to your stomach because it's going to be wanting to digest. So then all the contrast stuff will go to your stomach, and they won't be able to have it go where it needs to go to show them where your problem is. So yeah, I know it's really freaking hard, but now see, a trick I did that, see, they'll test your glucose with a little tiny prick of your finger. And so I actually would stick a cracker or a piece, just plain cracker, a plain piece of bread in my mouth, and just suck on it. And don't do that like continuously, but like once every few hours, when water just wasn't even doing anything for me anymore, and my stomach was just so, oh, you've got to do something, that would help me. But please don't take my advice as medical advice. Anything that you do, clear that with your doctor, or just realize that it's possible that if you do that at the wrong time, like too close to your test time, that you will have a little bit too much glucose in your blood. And sometimes if it's just a tiny amount over and they think, maybe you just need to sit for a few minutes, it could be from activity or whatever, then they'll, maybe delay you 15 minutes to a half an hour. I've had that happen. But if the machine is booked all day or something, they say, obviously you've been eating because your glucose level is too high, and they can tell, then unfortunately, that's the risk you take. And if you can't eat, then I'm not sure that cigarettes or anything really help. I think that makes me more hungry. I've had to quit smoking, by the way, and that's not been easy. That's part of the reason I'm doing the vlogs, because that helps me get through the nicotine cravings. Do anything that you can to get through the nicotine cravings. Do the tapping on the table, whatever you have to do, because after the nicotine's out of your system, those cravings will begin to become less and less. And keep yourself busy and mentally active as well as physically active. But okay, back to the subject. So then after the whole don't eat for 4 to 6 hours thing, and I had some water and a little piece of bread once, and they tested me, and my glucose was fine. So then you have to, depending again on what tech they're using, what kind of scan they're using, I was getting what was called a full contrast CT, and they had me drink a liquid with some kind of radioactive isotope in it at one, but then at another one they needed to have it intravenously introduced, and that was a little odd, and I'll honestly say it was a tiny bit scary for me to think about what they were putting in, but when she showed me exactly how much was actually in this injector, I realized it's probably really nothing for me to be afraid of. So what happened at that last one, it was a metal injector. The whole thing was metal, and you'd think, when I saw it, you kind of look at it, think, man, where did that come from, the 50s? It was in a metal box, and it was pretty heavy looking, like heavily shielded. And then she, put some extra thick gloves on that looked like they had some kind of a metallic something. And she put the injector in. That's when I asked her, well, how much is in that thing? Because it was a little big. And, yeah. And she's, there's only about this much liquid in there, really, and this is a thick shielding. Inside is a regular size injector. Oh, okay. Well, that sort of made me feel better. And when I did get it in to my vein, it didn't give me any side effects at all. I mean, they have to tell you all of the even 0.02% possibility side effects, but just because they say it does not mean it's going to happen, okay? Then after that, I had to lay on the bed for like an hour, and they had a headphone set, and they get Pandora, and they had like typed up whatever music I wanted, and I got to just lay there and relax for about an hour. And then they get you up and have you walk to the machine, which people will try to say, oh, it's terribly claustrophobic, and, whatever. It's not. It's not. I have claustrophobia. And I've had a lot of practice because I purposely manage my space so that I'm always, in a kind of a small space to begin with in my life. And then I'm used to it, so it helps me overcome it in the outside world. But even so, it doesn't last very long, the scan. And, literally, I was in the machine for maybe 15, 20 minutes tops. And they said for CAT scans, that's the longest one I'm going to be in. An MRI might take a little longer, but really, it's not that bad. And the machine is actually, you can probably raise your hand up about that high and touch it from your head. It's not like it's looming right over your head. So, I was okay in it. And you have, various types of machines will have various types of accoutrements that will help hold you exactly in place, because that's key to the scan, that you're exactly lined up with where the machine needs to be able to see what they want to see. And so there's these special pillows that are kind of full of weird plastic beads, and then they suck all the air out of it with a vacuum, and it immediately shrinks up and stays formed exactly to your body shape. And then they put a thing up under your knees, and you lay down on the bed, which isn't really very wide, so they gave you a ring to hold on to like that, so you'd stay still. And then they say, you'll have people say, yeah, but you gotta lay perfectly still, and who can do that, that you even move a single little muscle. That's not really true, because I remember feeling like, I know I just moved, and so now they're gonna stop, and they didn't. It was, the micron of a movement, just the tiniest bit of a movement, but I didn't do it voluntarily, but I mean, your body's going to be jiggled a little bit by the bed moving anyway, so it's not as bad as all that. Everything that people say when they're telling you how horrible things are, you should just, at this point in our scientific development, I would suggest that you take a few grains of salt to whatever they're saying, because if they weren't recently in that, if that was something happened to them 5-6 years ago, things have changed. I mean, they have made significant progression in our medical technology. And so I think that it's important to maintain, a sort of perspective where you're like, okay, I can understand where she's coming from, but I'm going to go look it up, and I'm going to ask someone that's actually recently had similar experiences. So that was my experience at that machine. And then today's machine, there was none of that. It was all just pretty much lay there and let the machine run its course. And then there was, the only bit of uncomfortableness was they needed to insert something and have it, be a marker for the machine to calibrate off of. And then there was little permanent marks they made on my hips with a little needle, just like getting like a dot tattoo. And it's fine now. It's not horrid. So again, with that said, you know, it seems intimidating when you first walk in, and your nurse is already right there with you, and your doctor will be right in. You know, they don't want to keep you waiting in there. They know it's intimidating. So take a deep breath. And they, you know, if you even show any sign of physical hesitation in your step, right away they're like, hey, are you okay? You know, we're here for you. So just stop. If you need to stop walking, just stop and take a deep breath and just say, I just need a second. And they will walk you through the whole place and show you everything and make sure you're comfortable first. So everything that they can do, and you know, like they were like, well, I was in the waiting room. You know, we have some coffee and stuff back here for you if you want anything to drink or eat. We have some cookies and brownies and things. I mean, they want to make you comfortable. So don't feel bad if you're like, feel like I'm eating too much of their freebie food or whatever. That's not what it's about. It's not about whether it's free or not. You're the one that's sick, and you're the one that needs help, and you need that food. You need to maintain your energy level and your nutrition level and your weight level, and take it. If they offer it to you, you take it. You deserve it right now. Don't hesitate. They want you to have it. And I've heard people say, oh, you don't need any more. You're fine. Just don't keep taking their freebies to the patients around me. And I'm just like, oh, Lord, no. And the nurses and everything will tell you this. If you need it, take it. That is what it's there for. Even if you don't think you need it right now, but you might need it in 2 hours, take it. We want you to have what you need. So please, don't hesitate. And again, if you need to talk, you get a hold of me on social media. So I'm going to let you go now, but you all have a good night.